we have the third speaker who's from healthcare management, is Dr. Raja Amarnath, who is a MD, DM, FCCP from Apollo Hospital. He is also like managing director for CIPCA and senior consultant at Apollo Hospital, Chennai. And he is a professor and head of Department of Pulmonary Medicine, Sri Balaji Medical College and Hospital, Chennai. And I think currently Dr. Raja Amarnath is seriously working with COVID patients. We heard about more about him. So thank you, Doctor, for joining this conference, this India Beyond Vision 2020, the challenges and opportunity, which is conducting by House of Kalam, Rameshwaram. So I just hand over the session to Dr. Raja Amarnath. Doctor, please go ahead.
First of all, I must thank you all for giving me this opportunity. I did not know when I joined this that it was based on Dr. APJ Kalam's dream that the theme of this entire session is that. I was thinking this is some other COVID related talk. So, but in a way, this conference, whatever is happening right now, is extremely close to my heart. It's because I am one of the ardent fans of Dr. APJ Kalam. And in one way, we are also doing something what the other two previous speakers have told. Ultimately, whatever the innovation it happens, whatever is the field, the innovation is called a noble innovation only when it reaches the final person, final man. So final beneficiary. As far as we are concerned in India, probably the final beneficiaries are the rural people. I am a pulmonologist and I have done my critical care, DM in critical care. I have been to UK for training. So I have seen, I am basically from a middle class background, had all my studies in government colleges and worked in the government hospitals, wards and ICUs. Then I have also seen the other dimension where the NHS level of ICU care, paperless ICUs, that's what they do. Having said so, once I came back to India 10 years ago, I was working as a consultant in a very big reputed hospital. I don't want to name it. But one incident changed my life, which connected us, the team of doctors to Dr. APJ Kalam's dream. One family came from Assam, husband and wife. Husband had some tuberculosis infection in his brain, for which they have come to Chennai seeking a higher level of medical care. It's a simple problem. TB, tuberculosis is something which can be treated anywhere. But they had no better ICUs over there. So believing that Chennai care is the best care available in India, they had come to Chennai for that care. I was the ICU consultant then, and I used to daily see that patient. I used to counsel the wife. Young lady, the husband was in mid-30s. This lady would be in mid-20s or maybe 30. As I was counseling her about her husband's condition, suddenly she fainted. So it was happened in ICU, so we had to rush and then do some basic care for her, and it was nothing to worry. Only thing was she felt very weak. So when we asked the reason, she said that she had not eaten for 3 days. The reason was they had come with a budget of some lakhs, few lakhs for the treatment, and it got over. She was trying to get arrange some money from her native place, which had not come yet. Whatever the money she had, she already paid to the hospital, believing that the medicines that were required for her husband in that care was more important than her own food and whatever the stay. That was one thing which has shaken my heart. That was then some of our friends who had who were all like-minded people. We started off something called as CIPACA. That's what the person who introduced this, he said CIPACA, which actually is a full form of our organization called Chennai Interventional Pulmonology and Critical Care Associates, which is an organization meant to uplift rural critical care services. We are a team of doctors, nurses, and patient counselors, technicians, all are well trained in critical care. We train ourselves. We embark on training people, especially on rural critical care. Today the critical care or ICU care in India is something like 5-star hotel kind of service. You can't get an ICU service for less than 30,000-40,000 rupees a day. So we wanted to see whether we can cut it down and make it feasible, economical, and available at the doorstep of people. If you look into the rural areas, what is going on currently is that if any taluk area or a rural area, if somebody gets a snake bite or a poisoning or a electric shock or even some small trauma or even a chest pain, for them to go to a nearby place, nearby even a district headquarters for a decent ICU care, the time period required to travel is at least 1 to 2 hours time. The golden hour is something that they lose. So many people, they suffer. Even though there are no deaths, the problem is they have to be transported there. When you lose the golden time, the situation becomes worsened. That puts on pressure on the patient for requirement of ICU care for even 1 week to 10 days more. It's a financial burden, emotional burden, health related burden, everything together. So then that is when we started off doing an innovative model of making shop-in-shop model of ICU services, wherein in other hospitals you take the place and then you run emergency and ICU services just by giving them manpower and required equipment. In that way, you don't require a large time to build an ICU, but it's a plug-in model, something like you go to a mall and then you start your shop inside. By that, because the establishment cost is low, we started off giving ICU care for people for less than 10,000 rupees a day. And then when the question comes how it is related to Dr. Kalam's heart, is that one, you can reach out to villagers, rural people at their own doorstep. You could cut down the time required for initiating the care, and most importantly, because there are no specialists available in those places, the best way was to get everybody online. So we have connected people through telemedicine and tele ICU services, wherein there is a round the clock supervision by the doctors, the specialists from cities who will be looking after those patients in a round the clock manner and giving the service, giving the advice to the on-site trained medical personnel. That is how you can match the care that is available in Chennai areas, Chennai hospitals, which is also available in rural places. Currently, we are running around 12 setups like that, which holds more than 250 exclusive ICU and emergency beds, wherein almost 100 to 150 patients every day from rural areas are getting an emergency treatment on time basis and getting their lives saved. This entire thing is based on Dr. APJ Kalam's dream, where we connect in two areas: innovation in the technology by means of connecting through tele ICU care, asking people around India at whatever the time they are available, they can log in and then look into the patient's details and then give their opinion, share their consultation, and also making something feasible, economically feasible, and then available at the doorstep of rural areas. Today, in this COVID crisis, when every other hospital in those areas was shut down because the government norms was that outpatient services and elective surgeries and general ward admissions have been shut down in the last 45 days. It is the only ICU services that are available in those places for emergencies, problems were these ICUs. As the previous speakers told, it is extremely important for the government organizations, especially the bureaucrats, to open up to such innovations in healthcare, where and all it is possible to connect the technological advancements with that of any innovation that can make things economically, affordable and reachable to the, as I said before, the final step of the beneficiary. All such projects are close to Dr. APJ Kalam's heart, and we are all his ardent followers, fans, and whether he is available, whether he is there in his physical body or not, his messages and his teachings and his guidance are the ones which have been guiding all of us from inside us, inspiring us on everyday basis, and they have been guiding us. I am happy to be part of this webinar and to share whatever the small efforts that we have been doing in the following the footsteps of Dr. APJ Kalam. And I thank you all for giving me this opportunity, and I will be happy to answer if there are any queries. Thank you.
Doctor, I have a question. This is Sheikh, Professor Kalam. This is related to COVID-19. So, we keep hearing from media and the news briefings that there are cases there is no symptoms, but they are called positive. What does that mean?
When somebody gets a doubt that he is exposed to COVID patient, okay, and you go and get yourself checked, and the virus becomes positive in your throat, that is COVID positive. But the patient, the person is not yet a patient. The person need not have any symptoms at all. No fever, maybe a mild cough or sore throat, but no fever, no breathing difficulty, no loose motions, nothing. Patient is absolutely fine. So that is when you call them asymptomatic COVID carriers. That is the word used. They are asymptomatic, but they carry COVID. These are the extremely dangerous people for the community. See, for them they may be good, but for community they are dangerous, because these are there are no symptoms for them. They will be going around and they will be spreading the disease. That is why it is very important to quarantine them for a period of 2 to 3 weeks.
Thank you, Doctor.
Welcome.
Thank you so much, Doctor. I think your session was heart-touching.
One question from here. One question from here.
Yeah, proceed.
One question. Yeah. If a COVID patient survives, is he going to have any permanent damage on his organ or any part of the body?
Good question. Is there any more questions? Okay. You are right. There is a possibility of organ damage only if the patient suffers a terminal respiratory problem. You see, COVID, when it enters the throat, and then it might go into the lungs and then cause so-called pneumonia in the lungs, and further proceeding into, there is a word called severe acute respiratory distress syndrome. That is what is called as SARS. That is why we call this virus as SARS-CoV-2 virus. That is the final damage that this virus can do to the body. If the patient develops that, usually such patients land upon ventilator. So these patients, even after they recover, they might have some structural damage to the lungs. But most of them, they recover fully. But some of them might have some residual structural damage to their lungs. It is a possibility. But as far as the patient is asymptomatic, only sore throat or a fever is there, never requires oxygen or admission into the hospital, and never requires ventilator, these patients, we can take it granted that they are out of the danger, out of the problem, and there is no residual organ damage to them. And other good news is that they would have developed antibodies. Any patient who recovers from COVID infection, he would have developed antibodies. So no risk of further COVID.
Okay, thank you very much, sir.